Tracking body composition on a fitness journey. You're probably doing it wrong. Dr. Allan here from Maui Athletics, and today I'm going to be going over the ultimate guide to body comp assessment. I was able to trick Dr. Grant Tinsley from Texas Tech into an impromptu interview who had just completed a study with his colleagues to look directly at this. In this video, we'll go over the study that they did, the pros and cons of body comp assessment. We'll look at a listing of the top 5 devices you should look at if you plan to do this at home, and I'll go over the recommendations for how to do this in the most accurate way so you get the best information possible. The purpose of this study was to figure out how off these estimates are, using reliability, cross-sectional validity, and longitudinal validity of 14 consumer-grade at-home bioelectrical impedance devices, similar to an in-body, and 1 research-grade device in comparison to a gold standard 4-compartment model. 73 participants were chosen to assess on these 15 devices, and then 37 were brought back in 3 to 4 months to assess how accurate these devices were at taking reliable measurements over time. Now, if you're interested in some specifics or some clarifications, I recommend you check out the caption here, as I've got a lot of good information there as well. Let's start with the pros. This is a very important thing for research purposes because it allows us to identify what at-home models may be good for people to use when they want to track body measurements over time. Number 2, body composition assessment methods are rather good at assessing average body comps for large groups of people. Number 3, it can be used effectively to motivate some groups of people if they have an understanding of the methods and the errors involved. Number 4 in pros. It may be best utilized by those who are professional athletes or professional level bodybuilding competitors, as they have a much more strict and regimented schedule. Now let's look at the cons. Number 1, body comp assessments tend to struggle when looking at an individual rather than a group. In other words, group level errors don't generalize as neatly to a specific person. The utility of body comp measurements tends to take a nosedive when you're looking at individuals rather than at research protocols in large groups. Individual level errors tend to be much larger than group level errors, and unfortunately with the drawbacks to testing methods these days, there's no way around that. Number 2, the reality is fat loss is not linear, and this information is far less useful than most people realize. Knowing your body fat percentage is not necessary in a practical sense for programming. You won't adjust fitness or nutrition based off this information. Grant says all body fat scales demonstrated enough error that you should be cautious when interpreting the results of an individual test, as well as changes detected by the scale over time. Since body composition measurements aren't reliable enough in a short enough period of time to guide programming, it's better to look at more reliable measures: rate of weight loss or gain on the scale, circumference of bodily measurements, how a person feels, their performance, their progress photos, or even how clothes fit tend to be better measures as far as programming goes. Number 3, BIA can be skewed by a variety of things: hydration status, previous exercise, errors of 2-compartment models compared to 4, or even the equations that are used tend to get a little bit wonky when you're dealing with people that have more body fat or more muscularity than the average person. Number 4, body comp measurements, including Dexa, tend to have a standard estimate of error of about 2 to 5% in the best of cases. In the worst of cases, this can be higher than 8% in overall reliability. Number 5, and my biggest concern for people that want to measure their body composition, is how much we depend on this for motivation. With the inherent errors in measurements and the potential errors between measurements, you may get a false sense of progress or lack thereof that could demotivate you when in actuality you are progressing. Grant states it succinctly when he says the concept of how large the error is for many of these devices, and that they are just one point of information, are hard to get people to believe. Now, he's not arguing for or against use, only that if you do decide to use this type of assessment, it's good to understand the benefits and risks involved. Now that we've covered the pros and cons, let's look at the top 5 performers in this study so you can get a good idea of what device you should get if you want to get the most out of tracking changes over time. Now, I want to point out that this list is different than the top 5 performers at a single point in time. The reason that we chose to do the over time period is that this is how most people will be using this at home to assess their progress. The Omron model took the top spot, with various Tinea models following close behind, but it is important to note that there was a consumer-grade in-body model on the study itself. It did not make the top 5 and clocked in at 2 to 4 times the price of the top 5 contenders. So let's talk practical recommendations and how to do this at home. Now, number 1, in most cases, I recommend against body comp tracking. Even in the best of cases, individual level errors are quite large, and therefore the information that you get from them is questionable at best. And since you won't be using this information to really adjust any fitness or nutrition programming, most of this information tends to be for curiosity purposes more than anything else. If you decide to test anyways, I would highly recommend choosing a testing interval that is appropriate for you. If you're a professional level athlete with very strict adherence, that means even staying nearly 100% on plan over holidays and special occasions, I would recommend a testing interval of no less than 1 month between readings. Unfortunately, that's not the reality for the rest of us. For most of us, holidays, special occasions, vacations, all of these things come into play, which means that our progress will not be as dramatic or as regimented. In those cases, for the average person, I recommend a testing interval of at least 3 to 4 months between readings. This can allow the magnitude of change between readings to be large enough to remove some of that noise from the potential errors that you're going to see. Lastly, it's important to remove any potential errors. One of the big ones that we talked about earlier was hydration status. Because of this, what you want to do is you want to set up a protocol that will allow you to minimize the issues that hydration status can have. When you take these readings, do it first thing upon waking, after going to the bathroom, before having any food or water. That will allow you to have the best chance of having a standardized hydration whenever you take these tests. There you have it. That is a very quick rundown of a well-run study, as well as all the bits and pieces that you'll need to be able to assess body comp if you so choose on your fitness journey. Hopefully this information will save you some money and emotional headaches. If you like the information here, give us a like, share, and a follow so you don't miss out on further fitness tips in the future.